We're here today on Facebook Live with Vandana Ahluwaila, who is the Vice President of the Canadian Rheumatology Association and a practicing rheumatologist in Brampton. Is that correct? Yeah, and we're really happy to have her here today. She's a very good friend of patient organizations, and we're going to ask you, Vandana, to just tell us a little bit about your involvement in the field of rheumatology and what your role is. Okay.
So I'm a community rheumatologist in Brampton, as you mentioned, Brampton, Ontario, and I've been there for, I think over 20 years now. I lost count. I love what I do, and a few years ago, as a result of one of my colleagues asked me to attend an Ontario Rheumatology Association meeting, and I didn't really know why I should do that, but over time I became the president of the ORA. And then I started to do some work around models of care, because I looked at the burden of arthritis and it was increasing, and I thought that we didn't have as good access to care as we should have. So I started working on that and trying to mobilize people and resources and trying to get our allied health professionals involved and working with rheumatologists in order to improve the access, because we could use the skills of those allied health professionals within our practices and also with the family doctors. So, and then after that, I have to continue my advocacy. And so I'm now the Vice President of the Canadian Rheumatology Association. I also do a lot of work around data entry in terms of electronic health records. I also work with the Ontario Best Practice Research Initiative and collecting data for registries that is going to help improve patient care. And I also work with the Arthritis Alliance of Canada.
Wow, it's busy, and I know how much patients have been involved in much of what you're doing and have been engaged and contributing. So, and I know just how much work you've done around the models of care, a huge deal. So I'm going to pull a few things out of what you said. First of all, so where do you see rheumatology care going 10 years from now with the models of care and how practice might change?
So we know from some of the work that the Alliance has done, the burden of arthritis is going to increase over the next 20 to 30 years. Osteoarthritis and rheumatoid arthritis are going to double. So we know from our workforce survey, it's called Stand Up and Be Counted, that was done in collaboration with the Alliance and the CRA, is that a third of our rheumatologists is going to be retiring in the next 10 to 20 years. We're not sure if we're going to have enough people to replace physicians, but I think it's really what happens in that, at that patient encounter and all of the other allied health professionals that really have to come together. We need pharmacists, we need occupational therapists, we need physiotherapists, we need social workers, we need also nurses as well, and we need to all work together to add our skills to the patient care.
So I see then, I think you mentioned your work around electronic health records, so they're going to become increasingly more important, where you have these multiple providers trying to communicate around that patient, and hopefully everybody's kind of knowing what's going on.
So you bring up an excellent point, because with the electronic health record, the chart doesn't have to be in one place, right? So when we work in our office, we have an ACPAC trained therapist, and she can log on and see exactly what I've done with the patient. When we work in our early arthritis clinic at the hospital, we log on to the same record, and we can pull up the patient's information, because oftentimes they're saying, well, I went to emerge. I was admitted to the hospital. How come you don't know about that? So that integration is coming, but I think that's when we sort of look at whether, if the patient could have one chart, that'd be really great.
Yeah, I mean, even if the patient as well could help and access that chart. So before their appointment, could go in and say, fill out the health qualities questionnaire and say how am I doing, and the specialist then would know beforehand, okay, so this patient's having this much problem, could actually facilitate the appointment and make it go even smoother?
Well, actually, that's a really good point. We have been working with some other vendors that are looking to create an interactive, called an API. Sometimes I don't remember what all the terms mean, but it's an interface between the EMR and their platform on an iPad or on the internet. So you know that you have a patient with a physician tomorrow. You could go in and do all of your personal assessments. Tell us where your pain is, tell us which joints are swollen, what's bothering you, or if you're doing great, right? And then when you come in, it would be really nice to focus on those pieces, right? And that would really help us take care of what's needed to be done today.
Yeah, sounds great. And I mean, we see increasingly, we're here on Facebook Live, and patients are using social media more and more to search for information, to engage with other patients. What are your thoughts around that? You get a patient coming in who's got their paper printed out and saying, "Well, Dr. Google says."
So at first I think I was sort of like, well, Dr. Google doesn't know anything, right? And then I read some other pieces that said, you know what, share Dr. Google with the patient. So now I go in and I say, okay, well, let's see what Dr. Google says. And let's talk about what that means and whether it's real or not, and what is the scientific evidence to support some of those things. So I think I've changed my outlook over time, because I don't think you can shut Dr. Google out, right?
And that's a way of empowering patients as well, to maybe take a little bit more control, because we know I've lived with RA long term, and we have to manage a lot of what's going on from day to day ourselves. So being proactive, I think, in that way might actually help with a better outcome.
Yeah, and we also help the patients find reputable websites that give them the right information, because that will really save their time, I think.
So, and lastly, I just, for the benefit of people, we're here at the CRA because, other patients can't be here, so we're hoping to share some of what's going on. What's exciting this year at the CRA for you?
Well, there's always so much going on. It's hard to say that one thing is more exciting than something else. I'm always excited by all of the new research and all of the new interesting things that are going on. So today I can't choose.
I mean, rheumatology certainly has been a changing field in the last 20 years, and very exciting from a patient perspective as well, to see the new treatments that weren't available, and the changing models of care and the different work that's going on can impact us so much. So just as a final, any tips for patients that are struggling with their RA or their disease right now, that lifestyle tips that they might help better manage their condition they can do?
Well, I'm good at motherhood statements. Eat well, exercise more, that sort of thing. But the one thing that I found for myself was to get a step counter. And I love my Fitbit, and I've switched to an iWatch now and everything like that. But I set my goals and try to make sure that I have my number of steps in and stuff like that. And I slowly increase that so that I'm increasing my endurance. And you have to start small and work up. But if you start, then you get somewhere.
It sounds like a great idea, and I know you're right. The motherhood statement seems so blasé, but I mean it really is true. The exercise, I know for myself, when I don't exercise in the winter when it struggles, that I don't feel as good as I do in the summer when I can get out and actually walk more. So really it is a big step to taking control of your health and feeling better. So, well, thank you so much for stopping by today. It's always really great to talk to you.
Thank you for having me.
And we look forward to what comes next.
And Dr. Vandana, we have one question that's saying, you were talking earlier about finding reputable online resources. So for someone who's considering that, what kind of tip do you have for them to help find these resources online?
Yeah, so resources that are provided by associations. So for example, the American College of Rheumatology has these resources. RheumInfo is an excellent resource. We sometimes have to actually purchase an access to UpToDate, but UpToDate also has patient information sheets that are attached to it. And those tend to be research-based, evidence-based, and sometimes they're very patient-friendly. So for example, RheumInfo, whenever I start a new medication, I will print out that patient-friendly sheet, and I will, make recommendations on it for the patient specifically. So it's very individualized, but it actually is a very nice layout that allows it to be understandable.
Great, perfect.
Thank you very much.
Okay, thank you.